state legislature is likely to consider allowing state-run hospitals to enter into private-public partnerships this session. The issue came up during this budget briefing at the Capitol with Hawaii Health Systems Corporation President and CEO Alice Hall.
This year we are asking for an emergency appropriation of $18.2 million for the following reasons. We are underfunded in the collective bargaining raises by approximately $11.2 million. That does not include Unit 9, which is still in negotiations. Federal reimbursement reductions of $4.6 million. And Kauai region is going to need at least $2.4 million more in order to make it to June of next calendar year. At the time we prepared this, we were going through the process of evaluating our cash. The real number, if we were to have 75 days accounts payable and 25 days cash on hand, is more like $26 million that's needed. The supplemental budget, we requested to the governor's office that they support an appropriation supplement of $52.6 million. About half of that is to pay down our AP to the 45-day level, and the other half approximately is to make up for the collective bargaining raises for fiscal year 15, federal reimbursement reductions, and the costs of our electronic medical record, as well as the roughly $8 million it's going to cost us to convert to ICD-10, which is mandatory, by the way. October 1 of next year, it's going to happen, or this year, it's going to happen. We are also seeking $2.9 million in general fund appropriations for the primary care residency program. The governor is supporting that request. The bottom line is that something does have to change for HHSC. We recognize that it's difficult for the legislature to come up with $130 or $140 million a year to support the hospital system. And the costs are going to keep going up. We can't give you a rosy picture saying that we think it's going to get better. And so what the various boards have come to realize is that probably the best solution is that we engage in a public-private partnership. We believe that this would allow us to gain access to private capital, to build and maintain our IT, increase access to services, address physical plant needs, and optimize clinical practice and care delivery. We would implement private sector compensation packages that would retain qualified medical service personnel. It would help us in reducing waste, and we would obtain more efficiencies of scale if we were part of a bigger system. And I think importantly for you, it would decrease over time our dependency on subsidies from the government.
Last year, it was reported that Arizona-based Banner Health was in talks with HHSC about managing the various facilities. However, the state legislature failed to approve any bills allowing any such agreement.
If you have any questions, I'm